On January 22nd, 2020, the first case of coronavirus was reported within the United States. And a month later, on February 22nd, that number of cases had risen up to 15. A month later, on March 22nd, that number had risen to 33,404 cases within the United States. And as of today, April 5th, there's a total of 311,357 cases and 8,451 deaths related to the coronavirus in the United States, according to the CDC. Today I'm going to be talking about what has caused all of our lives to be drastically changed so abruptly over these past few months: the coronavirus, also known as COVID-19. The first global case of the coronavirus, or COVID-19, came out of Wuhan, China, and was first reported to the country's WHO office on December 31st, 2019, reported by the World Health Organization. Since then, it has become a massive worldwide epidemic that is affecting over 200 countries. Charts released by Worldometer state that as of today, April 5th, there is a total of 1,272,860 cases and 69,424 deaths worldwide, and the number is continuously rising without being able to get an accurate count. Currently, there are 941,200 active cases of coronavirus, and of these, roughly 895,000, or around 95%, are in mild condition, while around 5%, or 45,000, are in critical condition. So far, there have been 331,000 cases that have reached an outcome, and of this, 262,200 have made full recoveries and been discharged from the hospital, which around 69,000 have died from it. This shows that the death rate of this virus up to this point is around 21%, which is rather high. COVID-19, or the coronavirus, is a type of coronavirus which is very common for catching the cold or any other upper respiratory infections. This is why the symptoms basically mirror that of a cold or the flu. They're very similar, and the symptoms are a dry cough, unreasonable fatigue, body aches, fever, congestion, a sore throat, and in some severe cases, patients notice difficulty breathing, and it just feels like they have a heavy weight on their chest. The incubation period of the coronavirus is 2 to 14 days, and the main source of spread is person to person. And this means that a person can have the coronavirus for up to 14 days without experiencing any symptoms, but still being able to infect people that they come in contact with, according to Harvard Health. There are many preventative actions that you can take to help protect yourself and stay safe and avoid catching and giving the coronavirus. And number one on this list is to thoroughly wash your hands. Washing your hands with soap and water for a minimum of 20 seconds is the most basic thing you can do, and it's also the most preventative that helps stop the virus from spreading. And a good way to make sure that you wash your hands for 20 seconds is to sing the Happy Birthday to You song in your head twice, because it's about 10 seconds apiece. Another big thing to do is avoid touching your eyes, nose, or mouth, and just your face in general, as this is where the virus finds a way to enter the body and begin doing damage and harm. And also another great thing to do is disinfect all of your items that you use pretty much daily, and you touch them after you're out and you have no idea what could be on them, such as your cell phone, your TV remote, your car keys, doorknobs. It's best to get the Lysol wipes that say that they kill coronavirus and use those against it. And also another really big thing to help stop the spread around the entire world that it's everyone's responsibility is to practice social distancing, because you can't catch it, you can't give it if you aren't around people. Like if you're staying in a single place, then you are not going to be infecting other people and you're not going to get infected by other people. Yale Medicine has stated that clinical trials for the testing of different drugs and a testing for a vaccine have already begun, and the FDA has actually waived the regulations to make clinical trials on human testing go as soon as possible. And with all of this stuff in place, a vaccine could still take up to or even over a year to produce, but it's necessary that they go through all these steps to ensure that the vaccine they release to the public is not actually damaging them and hurting them more than it's helping. Right now, the coronavirus is spreading rampantly, and without a vaccine, there's only so much medical personnel can do to help. They're doing everything they can, but as you can see, as of right now, it's not enough. And the best thing that anyone can do is just stay away from people and constantly wash your hands, and that cannot be said enough. We all have a responsibility in this to stop the spread of the coronavirus, and so everybody needs to be staying home and practicing social distancing and just not leaving your home unless it's an essential business and you absolutely have to. Only together can we stop the spread of the coronavirus. Thank you.